guys, this is Dr. Hub. Today we'll look at the cohort study. So what is the cohort study? So the cohort study, it progresses from cause to effect. So it goes from cause to the effect. So cause is nothing but the exposure and the effect is nothing but the disease. So it is AKA, that is also known as the forward-looking study. These are very important. The forward-looking study and also the incidence study. Then it is also known as a prospective study and the longitudinal study. So let's look at the design of the cohort. So firstly, the design, they starts with the population, the pop, and this is without the disease, So here, firstly, there will be, let's look at exposed. So among exposed, it is again divided into who develop the disease. They develop the disease or there can be no disease. So there are two varieties. Next, we look at the non-exposed. So in terms of non-exposed, we look at in terms of they develop the disease or there is no disease. So both ways there are two similar divisions, and there is in terms of non-exposed, it may be present and this is in the future. So in terms of sufficient time lag, there is a comparative incidence between the exposed and the non-exposed. There is a comparative incidence. This is between that of the exposed to the non-exposed. So this is basically a rough design or sketch about the cohort study. Now let's dive deep into understanding the types of cohort. So cohort types. The cohort study types, there are two, that is, there are three. There is prospective, it is nothing but the concurrent, it is concurrent. Prospective are the concurrent cohort studies. Next includes the retrospective. There is retrospective, that is nothing but the historical. Retrospective is the historical cohort studies. Next comes a combination. There's combination cohort studies. Now let's look at the steps. The steps of cohort is very important. That is, there is selection first. So the selection of the study subjects. So first the selection of the study subjects. Next involves the obtaining the data. So you obtain the data on the exposure. Next is the selection of comparison groups. The selection of the comparison groups. So first is selecting the study subject, then you obtain the data on the exposure. So first is select the study subject, then obtain the data. Third will be the select of the comparison groups. Third will be selection of the comparison groups. Next will be the follow-up. So you follow up. Next is the analysis in terms of the incidence rates. So you analyze the analysis in terms of the incidence rates and the estimation of the risk. Now we saw the cohort studies. Now let's look at what are the advantages, what's making it so special. So the advantage of the cohort studies is there is an incidence. Yes, incidence can be calculated. So incidence can be calculated. Next will be there are several possible outcomes. There can be several possible outcomes, and this is related to that of the exposure. And related to exposure, it can be studied at same time. So it is studied at the same time. Then comes the provides direct estimate of relative risk. So it provides direct estimate of the relative risk. Next comes the calculation. So there is calculation of dose response ratio. Then comes there is minimization of the certain basis. There is minimization of the certain biases. So this incidence can be calculated. It provides a direct estimate of relative risk, minimization of certain biases. This is to name a few. Now let's look at the disadvantages. So under the disadvantages of the cohort study, it cannot use for the uncommon diseases. So it cannot use for the common diseases. Then it is going to be expensive, and there is a large population which is required. Also there is a longer time is required. Then there is also common administrative as well as the ethical problems which are seen. There is the high attrition. There is high attrition as well as the selection, high attrition and the selection of subjects. This is going to be difficult. Then is the dynamism. So if you look at dynamism of the diagnostics, so dynamism of the diagnostics, so this is going to be difficult to incorporate. So it's difficult to incorporate. Lastly, the disadvantage is it tends to alter the behavior of subjects. So it tends to alter the behavior, and this is going to be of the subjects. So this is nothing but the Hawthorne effect. The Hawthorne effect. So this was all about the cohort study. We saw what is the cohort study. We saw the alternative names, the types, steps, advantages, disadvantages. We also saw a design or sketch of the cohort studies using a flowchart. So to learn and grow daily like this, please do subscribe.